No matter what your health, these are scary times. But when it comes to COVID-19, patients with diabetes and heart disease are some of the most at risk. They have higher rates of complications. If they get sick, they're more likely to end up in the ICU or need a ventilator. And the rates of mortality for people with those conditions is anywhere from 3.5 to 5 times that of healthy people. So naturally, patients with heart disease and diabetes are extra concerned about their health right now. I'm Gretchen Cuda Kroen, and I'm the Senior Editor of Practical Cardiology and Endocrinology Network. And with me today is Dr. Stephen Kopecky, a cardiologist at the Mayo Clinic in Rochester, Minnesota. Dr. Kopecky specializes in preventative cardiology, and so today we're going to discuss what patients with heart disease need to know about COVID-19 and how they can stay healthy and the messages that healthcare providers should be driving home. Welcome, and thank you for joining me, Dr. Kopecky.
Thank you, Gretchen.
I think I'd like to start with maybe you could just give us, an overview of what are the biggest concerns you as a provider of cardiac care have for your patients right now with COVID-19.
Yeah, there are some real key issues, to the infection and then to the results of the infection, which is the confinement we all have. And one of the biggest issues, of course, is lifestyle. Their eating habits and their activity habits. So if I try to tell patients, please try to keep eating the way you've been eating in the past. We tend to, at times like this, eat a lot of processed foods, a lot of foods that have extra salt in them, extra sodium. So it's sometimes hard to control that. So I suggest they weigh themselves daily, so they get a feel for what their weight is doing if it's going up. Because we know that as it starts to go up, you start to have symptoms. But the weight will go up 5 or 10 pounds before your symptoms occur, if it's fluid weight. So that's a key thing. Secondly, if they can continue to try to, make runs to the store to get some fruits and vegetables and the things that we know are the best for them, that also, and I emphasize to them, that actually improves their immunity, which, helps fight off any not necessarily COVID-19, but other, things they may be exposed to. Their medicines are very important. Try to make sure they keep taking their medicines, especially their ACE inhibitors or ARBs, because they read a lot about that.
Yeah, there's been a lot of that in the news lately about whether or not people should be taking those medications or not. And it seems like the general consensus is, yes, don't stop taking those medications.
Right. Almost all the societies have come out and said, please take your ACEs and ARBs, don't stop them. I mean, most of these patients are diabetics, they're hypertensives, they're on it for a reason, so that you really should stay on it. That's very important. Make sure you stay on your beta blockers. We don't want those to stop. Make sure you stay on your statins if you're on a statin, because both of those, if you stop them, you increase your risk for events, other events. Then if we talk about activity is really important, because some people don't want to go out or can't go out. They live in a gated or a small community, an apartment building. They don't want to ride the elevators, whatever. Then try to be active physically. And they say, well, I don't have any weights. I don't have a treadmill. I don't have a bicycle in my apartment or house. Then just use your own body weight. Do sit-ups, do planks, do push-ups, whatever you can do at home. Jog in place, do burpees, where you jump up and down and your feet go out behind you. Whatever it is you can do is very, very helpful, just to keep your fitness up and to keep your immunity up. We know that as you are less active, your immunity goes down and your inflammation in your body goes up. And the inflammation causes a lot of problems, like a plaque rupture if you have coronary disease. That's very important. And also it helps take care of your blood pressure, which is key. And for that, I explain to patients that your blood pressure is important, and they may say, well, but gee, it's only up 5 points from what it normally is. I'll say, well, that's not much, but when you think about it, your heart beats 100,000 times a day. And just minor elevations in your blood pressure multiplied by 100,000 are big. It makes your heart work much harder. So please take care of yourself.
So it sounds like all the things that we really should be doing all the time are actually just that much more important right now. The things we need to do to stay healthy.
That much more important, and they're that much harder to do. Don't run out of pills. That's very important. And I remind them that the flu season goes through end of May. And if you haven't gotten a flu shot, if you can get one, because the flu will increase your risk for heart attack and stroke. And studies have shown if you get a flu shot, you lower your risk of having a heart attack by 50% over that flu season.
Oh, really? That's quite a lot.
So, because it causes inflammation, which causes then leads to plaque rupture of a artery that you may already have narrowed. So
Now,
a lot of it.
Sorry, I didn't mean to interrupt you. I was just curious, is there anything that, cardiologists, cardiac providers are doing now that is that is designed to help people? So for example, you mentioned not running out of pills. Are people trying to be more vigilant about reminding their patients, like setting anything up in the office to, have, say, a nurse practitioner just give people a call? And I mean, is anything like that happening? Is there talk like amongst providers to try to like provide more support, I guess, for people who
yeah, they're definitely
at higher risk?
Definitely is. And so for instance, this morning, I've had 6 patients today that I've spoken to, either with audiovisual setups or like this, or telephone calls, non-face-to-face visits, and which the patients really enjoy and appreciate. And I say, we're not seeing people face-to-face right now, and that's going to be for a while yet, and that's all over the country, not just here. So let's talk a little bit about your health and what we can do to support it. And it may be an annual evaluation or maybe a new referred patient, but we shouldn't put those things on hold just because we can't, meet face to face in an office somewhere.
Yeah. Is part of that also keeping all your patients safe, right? That way nobody's coming into offices and exposing each other.
Oh, exactly right. No, that's very important to keep your distance, but you can talk like this. And I think it'll change medicine forever, how we do things in the future, because patients really do appreciate this. I found they're very efficient on how they talk to me on the phone. They're very focused. They have their pills ready. They're right there. Got the list of questions they want to ask. And it's delightful, I think, to interact with them in this way. And I think it'll continue on.
Yeah, I was actually wondering whether or not that's something that, we sort of got thrown into this push towards telemedicine as a necessity, but maybe once this is all over, it's going to change the way that we work.
Yes, I think it definitely will. And because I've done a lot of audiovisual visits in the last year at Mayo, where we have that available, with Zoom technology, et cetera. And I found that patients in general are very open to that. And it's not a gender thing. It's not an age thing. Old, young, male, female, they all enjoy it.
Do you think, or I shouldn't say think, but is there any data that suggests that doing these telemedicine visits actually have a positive impact on outcomes in practice? I think I remember a long time ago hearing that patients with diabetes, when they had these sort of telemedicine visits or some kind of contact with their provider outside of their regularly scheduled doctor visits, actually they saw a huge improvement in management of symptoms. And I would imagine that with heart disease, it's sort of the same kind of thing where people need to sort of stay on top of it and stay vigilant, and having this relationship with their provider that, is easier than coming to the doctor's office might actually have a big impact. And I'm just not sure whether there's any real data about that or not.
Yeah, there really isn't much data because this really hasn't been much of an option. We haven't gotten really much reimbursement for non-face-to-face visits in the past, either audiovisual or just telephone. But I think we're seeing more and more of that. And I think clearly, as you point out, in prevention world, obviously it's very different, because if you can keep their lifestyle good, taking their medicines, keep their activities up and their eating habits good, then that goes a long way towards preventing cardiovascular disease, because 80 to 90% of this is preventable.
In terms of changes that, or special things that cardiologists might be looking out for in patients, who might have gotten COVID, or, maybe they're not diagnosed as, is there anything that you, let's say, are looking out for with your patients, and you're sort of like on the, you've got your eye on saying, if this person is complaining, has this symptom or that symptom, I'm going to look harder, or I'm definitely referring them to go straight to the hospital. Like what are the things that you're sort of maybe on guard for that are different now with the coronavirus than they were before?
Yes. That's a very good question. And clearly we have our list of things we ask. You know, do you have a fever? Do you have a cough? Do you have diarrhea? Do you have a sore throat? And we're also asking things about, are you having pain in your chest when you breathe deep? Are you having problems breathing when you lay flat at night? Or your feet swelling? And that could be multiple reasons, but one of the things could be if you do have an infection, a COVID infection, could this be a myocarditis? Could it be a pericarditis, you know, causing the pain? The data is just not real clear on how much of that happens, you know, out of China, Italy, Turkey, other countries, Iran. We just don't know how much that's actually happening, but we're starting to look for it here. I think New York has they'll have some great data, unfortunately, with all their cases that they have there. But we have to be vigilant and look for that. And it's something that we have to alert patients to. On the one hand, on the other hand, we don't want to get them so nervous and worried about this. So we don't bring it up de novo. We ask, you know, if they have a conversation, they ask about it, or they say they have some of the symptoms. If they're doing fairly well, they don't need to come in the hospital. Then we talk to them about it.
It is a fine line, isn't it, between, you know, patients being aware of their symptoms and in touch with what's going on in their body and knowing, you know, when to be alarmed and not scaring them, right?
Yeah, no, very true. And it's in some patients, you know, you better not bring this up because it's going to be very difficult for them to, to let that, to kind of interpret that in the way they probably should in a positive way. So it's sometimes very difficult.
What do you think the one thing, if you were to have, you know, one or two things that you really want patients to know, and then maybe the few things that you would say to your colleagues about what they should be thinking about right now with COVID-19 and their cardiology patients?
Yeah. Well, with patients, very clearly, it is to try to keep the best lifestyle you can. You know, the eating is so important. You know, there's data from Super Bowl Sunday, which is the largest takeout pizza day in the country. And there's data that, you know, what happens to your lipids and how coagulable your blood gets. And so I say, don't repeat a Super Bowl Sunday. Don't think this is free reign to, take out food, fast food that maybe is not the best for you just because you're confined. You know, try to eat healthy as you can, which means more fruits, more vegetables, more legumes, less processed food, a lot less processed carbs, processed fat. That's very key. The second thing is try to stay active. That is so important. And even if you can just do 10 minutes with intervals, where you do 3 intervals, where you go hard for say 30 or 60 seconds, jog in place, run up and down the stairs in your house or your apartment building, whatever, that goes a long, long way. And keep up on your pills. You know, don't run out of pills. That's very important. And make sure that you kind of follow the rules or the recommendations. And what we know is the people that have gotten in trouble with infections in general, they think, well, I'll just do this one time, or I'll just expose myself here. I'm going to, meet with some friends, and it really isn't worth it, at least not right now. With colleagues, it's the same thing. I think the biggest stress, everybody's under stress, is not being able to work like we normally work. And that's both my colleagues, other, caregivers, providers, and patients. And we need to find ways to relieve our stress and daily, because I see a lot of it occurring with many of us, understandably so. And that means stay positive. That means when you go to bed at night or when you wake up in the morning, be thankful for 3 things. I don't care what it is. It could be that you don't have a cough or a fever, or, that you don't have COVID or your family doesn't. But that practicing optimism has been shown over time to lower your risk of heart attack, significantly so. And so just do the 3 things. I like to do it in the evening, because that's when I think about all the things I didn't get done today, I need to do tomorrow. Other people like to do it in the morning. Do both if you want, but practice positive lifestyle, positive thinking.
Yeah, I think it's a good point. I'm glad that you brought that up about emotional health here and its relationship to our physical health, because certainly I think there's a lot of evidence for that mind-body connection. And with heart disease and, it really does impact our heart health, right? To have a lot of emotional stress. And certainly there's a lot of people out there who are under an enormous strain, doctors and physicians being chief among them, simply for perhaps their exposure to this right now.
Tremendously. So true. And I think many of us turn to our screens at this time. I've spent more time on screens in the last week than I have probably the last month before that. But the other thing is late at night. It's been shown that if you go to your screen late at night, could be your phone, could be your laptop, could be whatever, that the blue light there affects you. For hundreds of thousands of years, our species has woken up in the morning for blue light. And when blue light goes away, we tend to go to sleep at night. That's what we've done, 100,000 years ago. But now with our screens, sometimes in bed, right in front of us, the blue light's exposed to us. And that actually late at night not only keeps us awake, but phase shifts us so that instead of not going to sleep as well, you also wake up early and you get sleep deprived, which we know is hard on your heart and your rhythms.
It's amazing how just these little things can make such a big difference.
Oh, it all comes down to 6 things, basically, that we have to do. We have to eat well and be physically active, because that's what our body has done for, hundreds of thousands of years. We need to avoid pollutants, which means smoking, obviously, and be careful with alcohol. I mean, I know a lot of people are making, liquor stores in here are essential, and they're staying open, and people are drinking a little more probably than they should. So take care of the pollutants that you tend to expose yourself to too much, and then make sure you continue the regenerative habits that regenerate and rejuvenate your body, which is number 1, sleep, and second is stress reduction. So, we have 3 kids. My wife loves talking to the kids and seeing them, and we can't do that for the last month. So we do Zooms with them. And we're noticing a lot of people are doing Zooms because it's out there. And last night we tried to talk and we had some trouble because the circuits were busy. But it's a great thing to do, just to see, your family's face and your loved one's face and know they're okay. And that does a great job to reduce stress too.
And wash your hands all the time, right?
Well, you said it. Wash your hands. Very true. And keep your hands away from your face.
Gotcha. All right. Well, thank you so much. Is there anything else that you'd like to add?
No, we've covered a lot of things, and I think that we covered the important things.
All right. Well, thank you so much for your time, Dr. Kopecky, correct? Did I get that right?
Perfect.
All right. I appreciate it so much, and I'm sure everybody listening is going to really appreciate the advice. So have a great day and good luck moving.
Thank you. Bye-bye.
All right. Bye.